This is how serene here is. The environment is a plug of healing and recovery. Notwithstanding, the wards at the facility has been modernized and equipped to one that combats stigma and improve healing access to people with mental health conditions across the country. On a tour to the facility with Matron Aniu Brahma, Sierra Leone Psychiatric Teaching Hospital, each ward has a caregiver that monitors the activities and response to patients. The wards have been transformed compared to its previous states. Each room now has decent beds, ventilation, fan, and television that entertain and keep their minds engaged. The cases of the inmate are drawn from bipolar, clinical depression, dementia, and traumatic case disorder, among others. But what mental health illnesses are associated with? Dr. Elizabeth Aliu is the acting medical superintendent at Psychiatric Hospital.
So there are so many myths in our society about mental illness, quote unquote, witchcraft, devil, naso mark. It's been mixed with tradition and culture. Religion also have a role. However, these three things, tradition, culture, and religion, play an important role also in us raising awareness about mental illness and even mental health.
Dr. Aliu stressed on their continued effort in giving their best treatment and care to people with mental illnesses in the country.
Mental illness treatment is free. The Sierra Psychiatric Teaching Hospital is offering free services for any person that is mentally ill. You don't pay to see a doctor. You don't even pay for medication. It's just to bring the person along that is mentally ill. Another bold step the president did was to appoint a special advisor for mental health. That is showing concern that this is a great challenge, and as a country we need to move forward.
She went on that 80% of the cases at the psychiatric hospital are substance use disorders. Ward 9, 10, and 11 have been designated to such patients who are mostly youth and teenagers. What efforts have been put in place to fight alarming cases of substance abuse?
We've started, we've embarked, we're doing really aggressive community, and I'll tell you, some offices will attest that we've gone to some offices talking about how to take care of your your mental state, because it starts from just a little stress, then you become so
The facility is also a teaching hospital that trains psychiatric and mental health nurses as per medical curriculum. These students are the future that will groom and counsel the mental state of the country. But how impactful it is for mental health to be factored in all the curriculum of nursing schools.
As you can see around, there are so many students from different schools to come and have practical in our facility, because we normally say there is no health without mental health, and mental health affects everybody irrespective of age, sex, wealth, color, creed, and whatever. It's better for them to be prepared mentally, or to have mental health nursing or mental health curriculum as a module, so that at the end of the day they will be able to appreciate life as it is.
So is it compulsory?
It is.
Some people might want to dodge from it.
You don't dodge from it. It is a course requirement. And at the end of the day, while they are sitting their state board exam, which is the final exam after their 3 years, mental health is a module.
Established in 2021, the Child and Adolescent Mental Health Unit was set up to promote good mental health for children and communities. The unit has numerous cases. Psychiatric nurse in charge, Sia Davis, said they cater for children from ages 1 to 18 with Down syndrome, autism, epilepsy, cerebral epilepsy, and therapy, medication and treatment, she said, reduces their seizures.
I know that it's really not easy for a mother to go to maybe 9-month, 10-month pregnancy, then just after the pregnancy, then your child is struggling with some health condition. We know that it's really not easy. So that's why we try our best to offer the medication and also backing it with the therapy, such as doing skills activity and also rendering some words of encouragement to the parents just for them to cope. If you want to work here, at first you need to have the love. Yes, the love, the passion. Yes, so we really have the love and the passion for us to help such kids. Yes.
The facility also has a rehab center, a symbol of recovery from substance use disorder. Mental health nurse Henrietta Scott stressed on the significance of the center, stating the number of recoveries they've had. Presently, 5 patients have recovered, set to be reintegrated to their communities. Nurse Aminata Kabia, attached to the male rehab unit, debunk the myth of people about psychiatric hospital.
Well, the problem with this mental hospital, although they may don't scatter the name of being a Christian, but as of now, we know they even get so much of mental cases. They get most of the substance use them in alcohol based now, they really get right now. Because this kush, tramadol, jamba also they affect most of the young girls and boys them. So it really they terrify every home. If you say 90% of the home then are salon, nobody know the winner. We not taste the bit of this poisonous drug where they right now in the country. And we hope and pray say God will carry the time way. We sister will free out of the suffering because it affects everybody. And up to now it affects we, and it really the pain we and the stress we even though they are because of them, but we're not gonna be happy where this thing just so fearful at the country.
Since 1980 to 2009, the facility at Kissy was headed by consultant psychiatrist Dr. Edward Nahim, who handed over to Medical Superintendent Dr. Godfred A.J. George from 2009 to 2011. Similarly, leadership was successfully passed on to Medical Superintendent Dr. Andrew T. Mwana. The last 7 years down the line, the facility was headed by Dr. Abdul Jallo, and as of 2025, Dr. Elizabeth Aliu is the acting medical superintendent. Government has launched a network of mental health champions in March 2025 to raise awareness and improve service delivery. The World Health Organization is supporting the government to replace the 1902 Lunacy Act with a new progressive Mental Health Act. Mental health is a state of emotional, psychological, and social well-being that affect how you think, feel, and act, and help you cope with life's stresses.